Hello dear patients, today we are going to review the case of white acne on glans penis. A man came to us with what he described as white acne on glans penis in about 3-4 days after a casual sexual contact. He didn't note any other changes such as discharges from the canal, etc., apart from itch in the area of such rashes. They were gradually spreading. He went to dermatovenerologic dispensary at the place of living, where he was set a diagnosis of candidosis of glans penis. This is my favorite diagnosis. He was prescribed fluconazole. He had it, but rashes only increased, so he decided to consult a different clinic. So here we see small papules, nodules. They are different from spots as they are thick in their base. They have a purplish-white color. Some of them, as you can see on the picture, even have a shape of plaques. So first of all, this disease is most commonly a manifestation of either sexually transmitted infections or it's a consequence of intake of medications. We had a video about it on our channel. Or it has an unknown etiology and it's called lichen planus. Indeed, it's quite often localized on glans penis, and in some cases, if sexually transmitted infections are present, we noted quite a good effect just due to treatment of sexually transmitted infections and addition of classic medications for treatment of lichen planus, such as sodium thiosulfate, calcium gluconate, and external therapy. So what was done for this patient? As he had a sexual contact, then blood was taken for syphilis, HIV and hepatitis that were negative. Analysis for sexually transmitted infections were taken. Gardnerella and ureaplasma were found. Culture test for ureaplasma was done, and history taken was done in order to find out whether there were any intake of medications that often happen during such disease, and they have to be either cancelled or changed, as externally there may be rashes that are not different from lichen planus, and their cause is intake of medications. Later on, classic treatment of Gardnerella and ureaplasma was prescribed. You can watch a separate video about it on our channel, with instillations and washing of the canal, with longidaza and antibiotics according to spectrum, where that was found according to sensitivity for ureaplasma as well as anti-Gardnerella medications, etc. We are not going to cover it now. There are quite a lot of videos about it on our channel. For treatment of lichen planus and such inflammatory reaction, sodium thiosulfate intravenously and calcium gluconate ozone were prescribed. Externally, careful massage by liquid nitrogen was prescribed, as the skin there is thin and sensitive. However, if this is done correctly, and as we often deal with sexual organs in our clinic, then we often use liquid nitrogen, and even for massage of skin of penis and glans penis, there's nothing extraordinary here. We prescribed Elidel cream and anti-inflammatory creams simultaneously. The treatment lasted for 3 weeks, during which the regression of rashes was about 80 to 90%. After that, sodium thiosulfate and calcium gluconate remained, and all other medications were cancelled. External treatment also remained. As a result of that, approximately in a month's time, rashes completely resolved. After a designated amount of time, we took necessary analysis for Gardnerella and ureaplasma that were negative. As I said before, we often note that even isolated treatment of found infections found inflammatory changes, as sometimes I find enterococci, bacteria coli, flora and inflammation, they play a significant role in treatment of lichen planus and other rashes on the skin of penis. Therefore, if any pathology is found, then it's necessary to treat it first, and to look at its effect of existing skin rashes, and to prescribe some external therapy, or if it's necessary, internal therapy aimed at this particular pathology. If it's necessary to diagnose and treat any rashes in the area of sexual organs, you can consult doctors of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced urologists and venerologists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.